Okay, this is a Tenet by Smith & Wesson. This is the distraction table for the hip, for hip replacement or hip arthroscopy or hip arthroplasty. Anyways, to set it up, comes in this rolling pull little kit, fun kit. To start setting it up, you have the table, the leg down, and that is so you can set the legs up along from the rail. So we have these rail clamps. You'll see them in most roll tables, pretty much everything. This is the main body. It's fully adjustable. This is where the legs go into. So what's going to happen is leg brackets, I should say. Put these on. Slide your brackets up. Pull it all the way up. And have this as close as you can to the foot of the bed. This is set up right now for a left hip. And that's because under this pad there's two holes. The operable side would be the hole here that it's supposed to go into. And that would be the side, left side. Oops. So that would be the left side. There's also a pad that goes over this, and then the patient gets moved up. Okay, next would be the table pad. Goes up in front. This just slides in. There's three receivers. Top one is for this, that gets covered underneath it for the legs. Since this is a left side arthroscopy, or left side operable side, this is going to be the adjustment system. This is for the operable side. So you'll see the difference. This one adjusts on both ends and also adjusts going back and forth. This one does not have the adjustment. This is the non-operable side. So this just basically holds it. It does have a slight adjustment here and here, but this is the distraction portion. So there's a lot more adjustments. This is on the non-operable side, which is the right side. And that's it. Basically 4 units. The center pad, the operable side, which has a full adjustment leg, and the non-operable side, which has just a holder, and it does have a slight adjustment on this. And then next, how we do it at Guilford is we just preset the bed up with sheets. Now the patient's going to be supine. The headpiece is up on the bed currently. The patient will be anesthetized on while the head is on the this end of the bed, and what happens is after that's done, this will go down and the patient will be pulled on a draw sheet. But I'll set this up right now. This is a regular setup, and I'll show you in a minute. pretty much all the pads are covered. Draw sheet, fold it in half. Now just put about mid-thoracic up to the, almost up to the shoulder. So the patient's head's right here. These are what we use, chunks. Those will go on your armboard. So you have your draw sheet here. First patient's head is going to be here. Next thing we do, sometimes I'll have it in, sometimes we won't, but I'm going to show you the big C-arm and which side it goes on. Okay, large C-arm. We also have the monitor. The monitor won't come in yet. We're using it. Monitor would go down at the foot of the bed. C-arm goes to the non-operable side. So essentially, the fluoroscopy will be coming from the non-operable side for the patient. So the X-ray tech will sit right next to this. Monitor will be down here. Patient now is laying feet here, head here. Anesthesia will anesthetize the patient once they're under tubed and under. We'll drop this down. Then us as a tech, so our tech, will be with the surgeon. What we'll do is essentially take this and draw the patient forward. One of the nurses will have one of the legs, bring them and put them into that foot, and also one of the legs that go into this foot. And the crotch of the patient will come into a post area, not this, but the padded post area, and we'll slowly advance the patient so they're right about here. So now the head is here. We don't need anything at the top. So essentially they're supine. Full adjustment will be done by the surgeon. So the surgeon takes care of all that, or the surgeon and the resident. This is your draw sheet, like I said, that stays under the patient. And at the end of the surgery, you can actually draw the patient back. Anesthesia will bring this up, bring the patient back. Post will come out, and the patient will be woken up. And we use a lifter, or they can come over. This will be taken off. And then the patient will be put onto the bed. And now you can move with the draw sheet, move the patient right onto the OR bed. That's it.